Well, hello. Happy Tuesday. Um, I'm going to be talking today about how the US healthcare system does not like to fix the root cause of the problems. It likes to cover up everything with a nice band-aid everywhere. So I would picture the healthcare system as like this big thing covered up with a bunch of band-aids, but not really fixing what is going on at the root cause. Perfect first example is the overprescribing of opioids. This was the first epidemic, not the first epidemic, but this was the big epidemic before the pandemic, the opioid epidemic. In 2019, approximately 50,000 deaths came from opioid overdoses. 50,000. They are prescribed often for pain management, which then leads to addiction and then unfortunately overdose. However, we're not fixing the underlying issues with chronic pain. We're also not fixing the underlying issues of why people are getting addicted. And from what I know, from what I've researched, a lot of it has to do with comorbid mental health conditions. People that are in a good place are satisfied, happy, not depressed, not having anxiety, and are, just happy tend to not get addicted. The people that are getting addicted are the people that are having already issues, and the opioid, it helps their pain, physical pain, but it also helps their emotional pain because they are struggling. And it kind of fills that hole. And a lot of people in America have that hole. And they've had that hole for a while. So I'll talk on that regarding mental health services later. But if we were able to get to the root cause of the mental health issues and even just address them, these would go down substantially. The next part that's not maybe well known is the excessive use of emergency rooms. So a study found that up to 27% of all emergency department visits could be treated at either urgent care centers or regular clinics, and this would save $4.4 billion annually. And this reflects basically a lack of accessible primary care and preventative medicine. I had a perfect situation where, I got bit by a dog, and you know, what do you do in that situation? You generally go to a lot of people think about going to the emergency room, but regular urgent care, a regular doctor should be able to treat that no problem, but good luck. It's impossible nowadays to get an appointment in time. It's very difficult, and it's just the lack of accessibility. And one of the reasons why is if you talk to a lot of primary care physicians, the money's not there anymore. The money is in the specialties, and it's difficult to run a successful primary care business, so therefore it's difficult to provide truly accessible care. Um, the next big one is high rates of hospital readmissions. So this is perfect example of a band-aid fix. So people are getting readmitted to the hospital because we're not really fixing their problem. We're kind of just like putting a nice band-aid, going, peace, bye, go home, and please don't come back. But then they come back. So 20% of Medicare patients are readmitted within 30 days, which costs over $26 billion annually, with $17 billion spent on avoidable readmissions. So this kind of suggests that we are doing these short-term treatments rather than long-term patient wellness and effective discharge planning. Um, and I know a few pharmacists that are involved in this transition and care area, and we need more assistance there to make sure patients are getting transitioned and then transitioned to long-term care to make sure they don't get into the hospital and become healthier. Um, and the next one would be like I said before, the underuse of mental health services, which is leading to just crisis situations. Approximately 56% of American adults with a mental illness do not receive treatment. And among youth, it's higher at 60%. 60%. So the healthcare system is failing to provide adequate mental health care. And this is leading to crisis interventions crisis interventions. Rather than early preventative care, it's much easier someone's really early in the stages of mental health issues to kind of catch it than when they're like about to jump off a bridge. Um, and I saw it personally just trying to make an appointment through my insurance. I had to create like five different logins. And eventually I just gave up. I was like, okay, this is just a waste of time. I can't do this. I ended up using BetterHelp because it was just way easier. Don't need insurance. It's pretty affordable, but most people can't afford BetterHelp. It's like $300 per month. Um, a lot of people are living paycheck to paycheck, not making terribly good money, especially the people that are having some pretty bad mental health issues for a long time. Maybe they can't work because of it. Um, and it's just not like a standard thing. I think that's the biggest problem. It's not a standard thing. It's almost like a weird thing that you go to, but it should be like a standard annual thing. Just like it's people go every year to the doctor, regular doctor, and maybe the dentist every year. Uh, wouldn't it be nice to go to a mental health provider? Um, and I have a different video on that regarding, I'll put that in the description, regarding how to do that and how to graduate from that so you're not dependent on that. Um, and I'm going to be providing updates on that because that's huge, is how do you be mentally health? How can you be mentally strong in addition to physically strong? The last thing I'll talk about is chronic disease management, which is focused very much on symptoms. And I would clarify symptoms, the word. I would clarify that as more like the blood levels. So basically, someone has high sugar, high blood pressure, high cholesterol, they have whatever other weird blood values, and our medical system is trained on basically putting the brakes on those things, or putting the band-aids on those things. Okay, let's bring the sugar down here, let's bring the blood pressure down here, let's bring the cholesterol down here. But there's like, it's almost like we've all given up on the idea that, well, maybe there's something that you can do to prevent those things from being high. And diet, exercise is like easier said than done, but where are our resources in terms of helping people do that? um how are we making it as easy as possible? Like, the easiest thing we're doing is giving people a pill. And as a pharmacist, I know that unfortunately all too well, and it's one of the reasons why I left. And chronic diseases in the US, such as heart disease, cancer, diabetes, they account for 7 of every 10 deaths. And treating people with chronic disease accounts for 86% of the nation healthcare cost. So this is what we're doing. We're putting band-aids all over us, all over patients, all over the healthcare system. And underneath those band-aids are basically sick people that are not being treated. Sick people. Um, and it's a lot. It's a huge issue, and this is what I've been trying to like partially uncover the past year or two in my investigative medical journalism. And it's just so terrible. And we need to wake up and realize we're not fixing people, we're making things worse in almost every disease state, especially in mental health care. I saw senior citizens on over five psychotropic medications, five, which basically makes them into a zombie. So they have, a lot of these people just have loneliness. They have loneliness, which leads them to have anxiety, depression, bad sleep. They are just lonely, and we're just giving this one drug. Oh, it doesn't fix their loneliness for some reason. Then you give another drug. It doesn't fix it, you know? And it's just very sad. Um, However, I am hopeful because, I mean, we're all aware about how bad the system is, and there's definitely some interesting solutions coming out of the woodwork. And yeah, happy to hear what you guys think about these problems and the idea of the healthcare system being just covered up with a bunch of band-aids and all of us being covered up with a bunch of band-aids. And on a personal level, I encourage each of you, if you're, I encourage you to be skeptical and instead of doing the easiest thing, which is taking a pill or, just doing the easiest thing possible, um, or getting surgery for for a certain thing, what can you do that's the harder thing? And the harder thing is usually the thing that helps you at the root cause. All right. Thank you for listening. Peace.